CMA AAMA exam tips and tricks. Let's get started. The order of draw in phlebotomy is critical primarily to prevent. Is it A, faster blood collection? Or B, reduced patient pain? Could it be C, additive carryover and cross-contamination, e.g., coagulation tubes before serum/additive tubes? Or lastly D, no significant effect? The correct answer is C. Here is why. Additive carryover and cross-contamination, e.g., coagulation tubes before serum/additive tubes, C, is correct. The standardized order of draw prevents trace amounts of additive from one tube, e.g., EDTA from a lavender top, from contaminating the next tube, which could falsely alter test results, e.g., potassium coagulation studies. It does not primarily speed collection, A, or reduce pain, B. It has a significant effect on test accuracy, D is false. Next question. Educating a patient on a low-sodium diet for heart failure/hypertension control, the medical assistant teaches. Is it A, canned soups are fine daily? Or B, read labels, aim less than 140 milligrams per serving low sodium, limit processed/canned foods, use herbs/spices instead of salt? Could it be C, high-salt snacks are okay occasionally? Or lastly D, no need to check food labels? The correct answer is B. Here is why. Read labels, aim less than 140 milligrams per serving low sodium, limit processed/canned foods, use herbs/spices instead of salt, B, is correct. This provides actionable guidance, identifying low-sodium products, avoiding high-sodium processed foods, and using flavor alternatives. Canned soups, A, are typically very high in sodium. Even occasional high-salt snacks, C, can exacerbate conditions. Checking labels, D, is essential. Next question. When processing wrapped instruments for sterilization, the medical assistant. Is it A, reuses without reprocessing? Or B, boils in open water only? Could it be C, leaves instruments unwrapped? Or lastly D, uses autoclave with chemical indicators, tape color change, logs cycle parameters, dates/labels packs, stores in clean dry area? The correct answer is D. Here is why. Uses autoclave with chemical indicators, tape color change, logs cycle parameters, dates/labels packs, stores in clean dry area, D, is correct. This describes the complete sterile processing procedure, using an autoclave, verifying sterilization with indicators, documenting the cycle, properly labeling, and storing packs to maintain sterility. Reusing without reprocessing, A, is unsafe. Boiling, B, is disinfection, not sterilization. Leaving instruments unwrapped, C, compromises sterility after processing. Next question. A patient with an implanted pacemaker arrives for routine ECG. The medical assistant. Is it A, skips the ECG entirely? Or B, no special precautions needed? Could it be C, uses higher voltage settings? Or lastly D, places leads carefully avoiding device site, notes pacemaker in report, avoids magnetic interference? The correct answer is D. Here is why. Places leads carefully avoiding device site, notes pacemaker in report, avoids magnetic interference, D, is correct. An ECG can be performed on a patient with a pacemaker. Leads should be placed standardly but avoiding placing electrodes directly over the pulse generator, usually in the upper chest. The report should note the presence of a pacemaker. Strong magnetic field should be avoided. Skipping the ECG, A, may be medically necessary. There are precautions, B is false. Using higher voltage, C, is not standard. Next question. In the daily billing workflow, the medical assistant posts. Is it A, no posting required? Or B, ignores denied claims? Could it be C, charges from superbill/encounter form, applies payments/adjustments, submits clean claims electronically, tracks denials? Or lastly D, manual paper claims only? The correct answer is C. Here is why. Charges from superbill/encounter form, applies payments/adjustments, submits clean claims electronically, tracks denials, C, is correct. This describes the core billing cycle: charge entry, payment posting, claim submission, and denial management. Posting is required, A is false. Denied claims must be addressed, B is false. While electronic submission is standard, some paper claims may still be used, but not exclusively, D is false. Next question. Administering oxygen via nasal cannula to a patient with COPD exacerbation, the medical assistant sets flow at. Is it A, mouth breathing route only? Or B, typically 1 to 6 liters per minute, titrate per SpO2 orders, humidify if for L, monitor saturation/respiratory status? Could it be C, always 10 liters per minute high flow? Or lastly D, no humidification ever? The correct answer is B. Here is why. Typically 1 to 6 liters per minute, titrate per SpO2 orders, humidify if for L, monitor saturation/respiratory status. B is correct. For patients with COPD, oxygen is titrated carefully to achieve target saturation, often 88 to 92%, to avoid suppressing the hypoxic drive. Flow rates are usually low to moderate. Humidification is often used for flows greater than 4 liters per minute to prevent mucosal drying. The mouth breathing route, A, is not a standard oxygen delivery method. High flow at 10 liters per minute, C, can be dangerous in COPD. Humidification may be needed, D is false. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.